Good morning, good afternoon, I guess. It's so great to see you. We're going to kick off. Thank you. Welcome, everyone, to this very critical discussion on advancing gender equality through SRHR. My name is Kathleen. I'm the Chief Strategy Engagement Officer at Plan International, and I'm really honored. Thank you so much for being your MC. We have 2 hours and a lot to accomplish and a lot to talk about. But we're very excited for this event in terms of advancing gender equality through SRHR, a pathway to bodily autonomy, health, and empowerment. Before we get into the discussion, as always, we have a little bit of housekeeping to do. So let's do that first. Important restrooms are in the hallway. There are, in case of emergency, there are lights and audible emergency signs. There is Wi-Fi, which is very important. The username is UNFPA guest, and the password is 5FIVE6457. Also very important, we do have interpretation. Very grateful for that. Please use the QR code. You'll see this on the screen here. For Zoom interpretation, we ask that you use your own headphones. English speakers, we will have some interventions that may be in other languages, so please use your own headphones and get out your iPhones. And then when you're on Zoom, if you remember, there's just the globe you can click for interpretation. We do have photography in the room, and so if for any reason you do not want to be photographed, please just see a member of the event team. Event team, can you raise your hand? Who should we see? Oh, there we go. Perfect. Please let our colleague know if you prefer not to be photographed. And then just last on participation and safety. Look, we want this to be a respectful engagement together, right? We're debating ideas and not people in this room. And so we ask, of course, that you're being respectful to all of the speakers and also in your questions. And maybe last but not least on housekeeping, lunch. Thank you to UNFPA. It is served in the hallway, so please at any time grab some food. I know we're together over the lunch hour. So now back to why we are here. We have 2 hours together as we mark the 30th anniversary of the Beijing Platform for Action, which really follows on from the 30th anniversary of the ICPD program of action last year. And this CSW provides a critical platform for us to take stock on the progress that we've made towards achieving gender equality and the challenges that remain. So ensuring SRHR is absolutely fundamental to achieving gender equality, as well as realizing bodily autonomy and sustainable development. Over the last 30 years, great progress has been made. We have to keep remembering that. And in the past 30 years, over 60 countries have liberalized abortion laws and really marking a step change in recognizing the right to bodily autonomy and choice. I think in this day and age, it's really important to talk about all the progress that has been made. Now, with progress, though, we know that there are still barriers, and we're going to talk about that this afternoon. There are restrictive policies. We've seen an increase in GBV, harmful gender norms, et cetera. And we'll be unpacking this in terms of what we see as an attempt to roll back the important gains that we've made over the last 30 years. So today we're going to look at both the challenges, but also the solutions. And I'm going to get very practical and ask all of our speakers that we're leaving this room with very practical solutions. That's really important as our way forward. So I'm really delighted. We're going to do a few things over the next 2 hours. So we have a number of high-level speakers. We're really grateful to have a number of member states in the room. We'll also have 2 short panels, one on barriers and on one solutions. If we can squeeze it in, we're going to have some Q&A. So please get your questions ready. And then, of course, we'll have a wonderful closing also by UNFPA. So to kick off our first speaker, I'd like to introduce, well, you probably don't need an introduction in your own house, but Dr. Natalia Khanum, who is the Executive Director of UNFPA, a fierce feminist and mentor. Thank you. Thank you.
Excellencias, esteemed partners, dear friends, dear young people, I greet you in peace. Peace is necessary, peace in our homes, peace in our hearts, peace in the wider world. This is what women and girls want everywhere. I am delighted to welcome you to UNFPA's Orange Cafe. Thank you. Thank you for seeing fit to join us as we celebrate 30 years of the Beijing Platform of Action. And it is now more than ever that we have to be grateful for each other who are willing to stand tall to defend the mandate that brings us closer to gender equality and closer to true sexual and reproductive health and rights, and the ability of every adolescent girl in her village, in her island home, on top of her mountain, to be able to say, my body is my own. Bodily autonomy is an expression of power, and that is what sexual and reproductive health and rights and gender equality speaks to. When I think about a midwife, and the midwife is always going to be the hero of the story. When I think about Susanna, who serves Rohingya women in Cox's Bazar, in that refugee camp in Bangladesh, it's the world's largest. Every day, she and her colleagues work tirelessly. Okay, it's cramped, you're in a tent, it might be threadbare, but they make sure that there are decorations, many of them made by the women themselves. And in her particular area, there are 6 cots. And it's not unusual for 12 deliveries to happen during the course of a typical day, 12 new babies. And despite all these difficult conditions, she remains committed to making sure that each and every one of the women that she treats gets the best possible care with respect, care with care. And when you have someone with a labor complication, she will also ask them, why didn't you come in early? Why, didn't you recognize that this might be problematic? The condition is so critical now. And you know what? All too typically, the woman is going to respond, my husband didn't agree for me to come. So stories like this are a testament to the conviction of that midwife and ours that everywhere women really have to have the right to be able to express these edicts, which are on paper, but have to come into the real world, into her life. This is what sexual and reproductive health care represents. It doesn't matter whether she's in a refugee camp or in a state-of-the-art hospital around the corner. There are so many barriers to women being able to express their right to say, my body is my own. Too many barriers that are going to impede her access to the type of respectful, loving care that we imagine when we think about true health, the state of well-being. Now, there are shortages in the largely female health workforce. We are also under-resourced when I think about maternity wards. And when I think about the gender norms, patriarchy is still real, limiting women's bodily autonomy. There are so many examples of misinformation and disinformation, and having to take that down and replace it with something that a teenager looking for answers will be able to responsibly use. These campaigns of spreading falsehoods about sexual and reproductive health, about contraception, about so much else that has to do with body rights, this leads to a persistent erosion of women's rights. We've seen recent decisions to terminate funding, so critical for the women's health programs, and underscoring the need for all of us to work in concert and to act decisively. It's not a time to take our foot off the gas pedal, if you will. What we really need is to accelerate. We need more global progress. As we've seen in the past 30 years, these gains are fragile, and it's up to us to defend them. The latest maternal mortality statistics, for example, highlight an alarming trend. And I'm just back from West and Central Africa, which sadly leads the world in terms of these statistics. It's every 2 minutes that a woman dies from preventable causes related to pregnancy and childbirth. And it adds up minute by minute to over 300,000 women each and every year who die. And it's a cautionary tale. It tells us what can happen when we fail, when we, rather than accelerate, when we backtrack. Entrenched gender inequality is what's preventing millions of women and girls from accessing vital services, and that includes maternal health care and family planning. It denies them the ability to make informed choices about their health care. Too often, the decision is made for that woman, and too often that woman is a girl, and it's her partner, her family, her society, sometimes even their government, that tries to claw back that claim that her body is her own. We see this as we in UNFPA monitor data towards the Sustainable Development Goals. There's so many disparities in women's decision-making power and their access. The dismantling of rights and choices also isn't happening in isolation. The pushback against women's rights, against reproductive rights, against comprehensive sexuality education that would protect a kid from falling down, and now we have to figure out how to keep her on track to finish her education. Ignorance is totally different than innocence, and this is the value of educating a young person for the future. These are safeguards. One essential tool that I really appreciate is the leadership of young people as we fight the pushback on rights. They're really clear. They understand consent. They understand their rights. And at this point, I think the leadership of young people is a factor that will challenge the misinformation campaigns, that will also challenge the political opposition, because people want to move forward. Trusting in data, in facts. Why do we question this now? Because disinformation puts a veil, if you will, over the clarity that we need in order to make a good decision. And the regression is endangering not just women's health, but world health. We see the pushback against vaccine campaigns in many places. And the cornerstone of gender equality is indeed evidence, data, facts, and truth. The convergence of Cairo, that ICPD, the International Conference on Population and Development, and Beijing, and dare I say, Huairou, because it was in Huairou where rural women put their agenda for gender equality to be met with development. This is why ICPD, population and development, also go together. How are you going to develop if half of the population is being held back? So for me, 35 years after Cairo, 30 years after Beijing, these agendas have stood the test of time, and we've been tested. Things like the Mexico City policy, the gag rule. We've been told time and again to call it by its name and don't bring Mexico into this. Now it's time to redouble our efforts. And now it's time to reinvigorate our commitment. Now, it's a critical juncture. We're reading the headlines. We know that we're not going to wait and see how the wind is blowing. We've got to be proactive, and we've got to get ahead of stating over and over that sexual and reproductive health and rights are not negotiable. Women's lives are not a game. So in this climate of shrinking resources and rising opposition, it's going to take each of us spreading our message, acting with ever greater urgency and determination. And what I'm asking of you is to safeguard health systems so that they're resilient. We had some practice with this during COVID, where we saw the surge of gender-based violence and so much else, and we reacted. And I think now we step up, we support the training, the deployment, and the retention of the health workforce, 70% being female, and that includes midwives, the backbone of sexual and reproductive health care. And be unwavering. Be willing to be the person who speaks up. Of course, there's room for compromise and respectful discourse, but we have to insist on clarity and on truth. We have to challenge discriminatory law and policies. We have to work with people in all our sexual diversities to reassert the dignity of the human being and to combat all of the stereotyping and the taboos and the social norms and fight for women's agency and to end harmful practices so that women will truly decide over their own bodies. Let me just close by telling you that, yes, I was actually in Mexico City 50 years ago. I also had the honor of attending the Cairo and Beijing conferences as a young professional. And one of the people I met who's had an indelible imprint upon me, and I was so fortunate to have been a friend and a protege of the celebrated Wilma Mankiller. Mankiller was the first woman chief of the Cherokee Nation. And I wanted to quote her in this space because it was she who said, "The secret of our success is that we never, never give up. We cannot retreat. When we retreat, who's going to meet the needs of women and girls? Who's going to build that resilience? Who will be there to deal with the knock-on effects of so many closures abruptly and suddenly ending what we thought was a health system?" Let us come together. Let us continue to build a global community that does act, that does everything we can to support women, and in this short term, to cushion those blows that these difficult times require us to help lift women up. And I assure you that UNFPA's commitment to women and girls remains absolute. We will keep pushing for sustained funding for sexual and reproductive health and rights, not just for our agency, but for our beautiful sector. And we will work tirelessly with you and all our partners to protect the safety, the dignity, and the freedom of every woman and every girl. We never, never give up. We will not go back, and we will absolutely uphold the dignity and the worth of every woman and every girl, and we will keep pushing forward, and yes, we shall prevail. Thank you.
Thank you. There's not a better champion. Thank you. We're going to move to our next segment. Just before that, I just heard that someone may have lost their passport. If you did, do not fret. Dawn in the pink can help you. If you've lost your passport, please see Dawn. But Natalia, thank you. Just 2 points I pulled from this, was many, was just that, as you say, the essential tool is the leadership of young people today and now, and also just safeguarding our health system, ensuring its resilience, just really, really important. We'd like to transition to our next segment, so I'd like to invite our member state representatives to the stage in any order. If you'd like to take a seat, the representatives of Sierra Leone, Panama, Moldova, France, and Spain. If you'd like to grab a seat, thank you. Great, thank you, Natalia. Excellent. We're really on, what? Yes, yes, thank you. Excellent. Well, we're really, really honored, Your Excellencies and special guests. Thank you so much for joining us. We are going to hear from each of our esteemed guests, and they've each prepared about 5 minutes. We're going to try to get through everyone. But we will start, of course, with, our favorite minister, Minister Izata Mahoy. We've been together all week together, just a champion for girls. Sierra Leone has really made significant strides in strengthening SRHR and has made significant progress in improving access to quality maternal health care and advancing gender equality. So, Your Excellency, the floor is yours.
Excellencies here present. The Executive Director for UNFPA, Madam Natalia, we were together in Senegal a few weeks ago. I feel privileged standing in front of you to tell you the story of our country, Sierra Leone. First, we know sexual reproductive health and rights are intrinsically linked to gender equality. For me, I believe that if you do not promote sexual reproductive health and rights, you will not be able to achieve gender equality. Also, access to SRHR services, including contraception and family planning, allows women to plan their families. And this enables them to also stay in school longer, which is very key in terms of developing the girl child so that they will be able to pursue higher education and participate more fully in the workforce. Sierra Leone has made tremendous progress when it comes to advancing SRHR as a pathway to women's health and empowerment. The government continues to prioritize an enabling legislative framework for the realization of gender equality and positive SRHR outcomes. First, the Gender Equality and Women's Empowerment Act, which was enacted in 2022. It is a significant piece of legislation that aims to address gender imbalances and promote women's empowerment. The amended Sexual Offences Act of 2019 and the Prohibition of Child Marriage Act of 2024 represent efforts to strengthen legal protections against gender-based violence and harmful cultural practices. There are two other progressive legislative pieces who are currently in Parliament: the Safe Motherhood Bill and the Reproductive Health Rights and the Child Rights Bill. You know, the challenge we face is for our leaders in Parliament, for them to be able to think progressively to pass these particular bills. This is the challenge that we face as a country, because changing mindsets from deep-rooted traditional norms is something very critical in our culture. And today, as I stand there, I want to say, despite the challenges that we face with Parliament, I remain committed as the Minister of Gender and Children's Affairs. I will push till we have these particular bills, which are to protect the rights of our women and girls. Through these laws, the implementation of various policies and strategies, Sierra Leone has been able to make some significant strides, including a 74% reduction in maternal mortality over a period of 20 years, from 1,682 deaths per 100 live births in 2000 to 443 deaths per 100 live births in the year 2020. However, we still have a lot to do. We are still far above the threshold of 70, which is being the target for the UN. Through a digitized pregnancy registration and tracking system, the Ministry of Health is implementing collaboration with its partners like UNFPA. The country is accelerating progress towards zero maternal death by digital registering and monitoring each pregnancy, ensuring timely access to health services throughout the pregnancy. This is very critical for our women. Sierra Leone is a country where mostly are illiterate. And for you to be able to use a digital system to get pregnant women to have access to services is a plus for that particular country. Clap for us, we have made progress. Through the rollout of comprehensive sexuality education, the Ministry of Basic and Senior Education is advancing gender equality by empowering learners with accurate and age-appropriate information about SRH. CSC also helps young people critically examine the challenge traditional gender roles and stereotypes that limit their potential. This is also very critical because our society is a more traditional society. For anything that you do, you associate it with those traditional norms. And it is very difficult for women to navigate within this. And this is why till today, the Child Rights Bill is being difficult to pass in Parliament because of the FGM clause that is there, only one clause. They did not think about all the other progressive clauses that are there, the one that support child labor, the ones that support other things like trafficking and others, cyberbullying. except for the FGM, which is being delayed. And this is why we need a mass of people in that particular country that will say, enough is enough. Let us work together to protect our young women. Family planning is a cornerstone for gender equality, and it directly impacts women's ability to control our own life and destiny. It is the man that decides whether you are to have family planning or not. It decides whether you have to have children. Your body is your right, and nobody should dictate on what happens with their body. The challenges so far, despite progress, challenges remain, including entrenched cultural norms, which I have already talked about, gender biases and disparities in access to education and healthcare and other productive resources. Patriarchal and religious systems often seek to control women's bodily autonomy, and this usually manifests in restrictions of access to contraception and other SRHR services. There is also sexual and gender-based violence that remains a very huge challenge. Before coming here, an 18-month-old child was raped.
Oh my God. Yes.
Within the ambits of her home. 18 months old. This child was in Pampers. This child cannot speak to say, who did this to me? And it becomes a challenge. Well, thanks to God for the efficiency of the Ministry of Gender and Children's Affairs, which I represent, and the Family Support Unit, we are able to apprehend the perpetrator. Today is behind bars. And as I go back to Sierra Leone, I will see that he's being locked up in jail, considering the laws that we have. There is also inadequate data to measure national level progress. We need to invest in data. Without data, we'll not be able to prioritize our needs. Without data, we'll not be able to make decisions on which policies to develop as well. So data is very key, and this is a challenge. For opportunities, the government has demonstrated commitment to show that there is the political will, especially from His Excellency the President, who is a he for she, who wants every law that has to do with the protection of women is the law that should be binding on the state. He is there, very productive, and thanks to his wife, the First Lady, she has championed many of the initiatives. She's the champion of the Hands Off Our Girls program. She's also the one that championed the Prohibition of Child Marriage Act to be passed. I want to say, as we come here today as a country, I want to conclude by that, as we celebrate the Beijing Plus 30, we must remain committed to placing sexual and reproductive health rights at the center of gender equality advocacy. We must also continue to advance the spirit of International Conference on Population Development Program for Action, which called for eliminating all discriminatory practices and promoting gender equity and equality. Sierra Leone is committed to building a future where SRHR is not a privilege, but a fundamental right, and where every woman and girl can live a life of dignity, health, and empowerment. I thank you.
Thank you, Minister, so much. And just to say, I'm going to try to pull successes, but just to say, I want to, as the Minister is leaving, just as she noted, in her country, 74% reduction in maternal mortality. So that is something absolutely to celebrate. We next will go to Moldova. Moldova has shown unwavering commitment to advancing gender equality, advancing women's rights, and combating GBV. And we are privileged to have Joina Gurman, the Deputy Speaker of Parliament, here with us today for Moldova's opening remarks. Your Excellency, the floor is yours.
Thank you, dear Kathleen. Good afternoon to everybody. It is a real honor for me to represent my country here in New York. Distinguished Executive Director of UNFPA, Dr. Natalia Kanem, distinguished guests, esteemed colleagues, and dear friends. It is with immense privilege as a co-host and on behalf of the Republic of Moldova, I welcome you to this side event at the 2025 Commission on the Status of Women. We are deeply honored by the presence of such a diverse and dedicated group, representatives from member states, our valued partners from UN agencies, passionate civil society leaders, inspiring youth advocates, and renowned experts. Your presence here today speaks volumes about the critical nature of this topic. This year, CSW 69 provides a critical opportunity to reaffirm our unwavering commitment to gender equality. At the heart of this commitment lies the fundamental principle of sexual and reproductive health and rights. I am proud to say that the Republic of Moldova has taken bold strides toward gender equality, preventing and combating gender-based violence, and assuming sexual and reproductive rights for all. Our government remains deeply committed to creating a future where every woman and girl can live with dignity, safety, and full agency over their lives. This event is not merely about identifying challenges. It is about celebrating victories and showcasing cutting-edge, rights-based approaches. One powerful example of this commitment is Moldova's historic ratification of the Istanbul Convention in October 2021. Moldova has become the 35th state that ratified the convention. Moldova is a nation of action, not only of words. We established quite recently, the new National Agency on Combating Gender-Based Violence. And here we have the General Director of this agency, Viorica Țimbalai, accompanying me. And this agency is under the highest level of the government, the Prime Minister Office. This agency plays a crucial role in coordinating national efforts, implementing policies, and ensuring a survivor-centered approach to tackling gender-based violence. But we do not stop at policy, we breathe life into them. With the growing prevalence of digital violence, we appreciate the huge support of UNFPA in advancing legal amendments to address technology-facilitated gender-based violence. Additionally, initiatives such as the Body Right campaign have been instrumental in raising awareness and advocating for stronger protections against online harassment and exploitation. Education plays a vital role in shaping a more equitable and informed society. Moldova has made significant progress in implementing comprehensive sexuality education, ensuring that young people receive accurate, age-appropriate information that empowers them to make informed decisions about their health, relationships, and futures. With UNFPA support, schools in Moldova have access to a menstrual hygiene program and free menstrual products as part of the EduLife program. The adolescent pregnancy rate in Moldova has reduced by 25% in the last 5 years. While we celebrate this progress, we acknowledge that the rate remains high compared to other EU countries, and we will continue our tireless efforts. Access to sexual and reproductive health services is a fundamental right, not a privilege. The government of Moldova is committed to ensuring this access for all, particularly for vulnerable groups. We have allocated state budget funding to provide free of charge contraception to those most in need: women with disabilities, young people, women living with HIV, women with the low income, and other groups, reducing financial barriers and promoting reproductive autonomy. This initiative is a testament to our dedication to upholding the right to reproductive health and choice. It is about building a better future for women and girls, but also we are responding to urgent needs of today. In response to the ongoing humanitarian crisis, Moldova has opened its heart and its doors, becoming a place of refuge to hundreds of thousands of Ukrainians fleeing the horrors of war. From the very first days of the crisis, we have witnessed the resilience of those forced to leave everything behind, mothers carrying their children across borders, young girls seeking safety, and families uncertain of what tomorrow will bring. We are deeply grateful for UNFPA support in establishing safe spaces for women and girls, reaching over 100,000 refugees and those from host communities. Additionally, with UNFPA's assistance, we have equipped 12 perinatal centers for safe maternity care and established sexual violence service units in hospitals, providing essential medical, psychological, and legal support to survivors through a trauma-informed approach that prioritizes their well-being and dignity. Dear friends, as we gather here, we are reminded of the powerful and enduring legacy of the International Conference on Population and Development and the Beijing Platform for Action. These landmark agreements, now making their 30th anniversaries, remain as relevant as ever. Let us live here today not only inspired, but committed to taking concrete action to ensure that every woman and every girl in my country, Moldova, and anywhere in the world enjoy their sexual and reproductive rights, are free of violence, and enjoy safe lives that make them thrive. Thank you.
Great. Thank you so much, Deputy Speaker. And you had so many important points. I want to pick one out. Congratulations again on establishing the new National Agency for GBV, and also wonderful to see the Deputy General here. Next, we move to France. France has long been a leader in advancing gender equality, championing women's rights, and implementing progressive policies to combat GBV. We're honored to have here Ms. Isabelle Rome, Ambassador of France, to share France's perspective on advancing these critical commitments. Your Excellency, the floor is yours.
Thank you. Mrs. Director, dear Natalia Katem, Excellencies, Ministers, Ambassadors, ladies and gentlemen, I would like to thank the United Nations Population Fund for the organization of this event and its crucial work for women all over the world. But I would like to start by saying that the UNFPA action and sexual and reproductive health and rights are not only about women, but men and children too. It is about human dignity and health. France is deeply committed to promoting and ensuring sexual and reproductive health, both within its national policies and through its feminist foreign policy. Gender equality has been a priority for our president and the French government since 2018. Since then, many laws and policies were adopted in order to improve health public services and women's health by supporting women who have suffered a miscarriage, guaranteeing full coverage of contraceptive pills, morning after pills, and male and female condoms in pharmacies for young people up to the age of 25 without a prescription. Rolling out a national strategy for better endometriosis care. Today, we celebrate an important anniversary. 1 year ago, France enshrined the freedom to have an abortion in its constitution. In addition to the highly symbolic significance of this step forward, it is also a protection, a guarantee for French women that this right is protected by our highest law and cannot be taken away from them. As you may know, France was among the first countries to officially adopt feminist diplomacy in 2019, making women's rights and gender equality a priority in its foreign action. Our new strategy for feminist diplomacy has been launched on March 7th to celebrate International Women's Rights Day. The defense of sexual and reproductive health and rights and the fights against gender-based violence are our main priorities. Sexual and reproductive health and rights, and especially the right to resort to abortion, is inalienable. It is fundamental to women's health, life, and freedom, as well as for the full realization of gender equality. As part of the Generation Equality Forum in 2021, France has positioned itself as leader of the Action Coalition on Sexual and Reproductive Health and Rights. It pledged 400 million euros for the period 2021-2025 to promote comprehensive sexuality education, access to family planning, and legal, safe, and medical abortion throughout the world. These commitments consist in supporting the United Nations Population Fund, UNFPA, Partnership Supplies Program, the Shaping Equitable Market Access for Reproductive Health Program, the Organization for Safe Abortion Dialogue, and France's Muskoka Fund. France has launched its second international strategy dedicated solely to sexual and reproductive health and rights for the period 2023-2027. The key commitments and actions it contains are now reaffirmed against a backdrop marked by a decline in the right to abortion and SRHR, particularly in emergency situations. We are watching with concern as anti-rights movements, even more present, better organized and financed, threaten to roll back gains in gender equality and women's rights. This CSW is maybe more than ever an opportunity to work together even more closely to prevent any attempt to undermine gender equality and to ensure our full mobilization and participation to this end. As we celebrate this year the 30th anniversary of the Beijing Platform for Action, I want to reiterate my country, France's commitment to SRH. It's difficult for me to say SRHR and gender equality, and our full solidarity to feminist organizations. I would like to conclude by repeating that women's rights are human rights. Their protection is not only a women's issue, it is necessary for all humanity. Thank you.
Thank you, Ambassador. And again, so many things we could comment on, but we'll pick maybe the most important, obvious, enshrining the right to abortion 1 year ago. So again, thank you. Next, we have Spain. Spain has been a steadfast advocate for gender equality, championing women's rights and driving progressive policies to combat GBV both nationally and globally. We're honored to have Ms. Cristina Hernandez with us today to share Spain's perspective. Thank you.
Muchísimas gracias, buenas tardes. Me voy a dirigir en castellano a todas ustedes, querida directora, amigas y amigos. Es un honor hablar en nombre de España, del Gobierno de España, en un espacio como este y en un momento como este. Y si hablamos de derechos sexuales y reproductivos, el contexto político que vivimos importa y nos determina la acción política. Dice la famosa filósofa y la famosa cita de Simone de Beauvoir que bastará una crisis económica, política o social para que los derechos de las mujeres sean cuestionados. Creo que estamos en ese momento mundial en el que los derechos de las mujeres están siendo cuestionados. Vivimos tiempos muy convulsos. Yo nunca imaginé vivir en un mundo donde la ciencia podía ser menospreciada, donde el conocimiento podría ser menospreciado, donde no volvería a valer o no tendría tanto valor el conocimiento experto. Pero ese es el tiempo al que estamos viviendo. Y creo que la reacción ultra conservadora a la que nos estamos enfrentando las feministas se articula sobre todo en torno a dos temas. Todo lo que tiene que ver con la crisis climática, porque es imposible hablar de cambio climático sin abordar un nuevo modelo económico. Y también todo lo que tiene que ver con una reacción antifeminista, porque las mujeres venimos a cambiarlo todo, pero sobre todo el poder. Y creo que la reacción ultra se está articulando en torno a en torno a estas dos ideas. Por eso es importante hablar del contexto, que se percibe, que lo sentimos las feministas en todos los países, independientemente del color político que nos gobierne, ¿no? La reacción le estamos haciendo frente en las instituciones, pero las feministas lo están sintiendo en las calles en cualquier lugar del mundo. Voy a hablar en nombre de España y podría hacer un discurso bastante complaciente frente a ustedes, pero creo que también es mucho más útil, estratégico para todas nosotras que les cuente también cuáles son las dificultades que estamos abordando. Mi cita favorita es que quien quiere la democracia tiene que querer también al feminismo. Los derechos de las mujeres no son un anexo que se puede negociar, recortar en negociaciones o para formar gobiernos. La capacidad de las mujeres para decidir sobre nuestro cuerpo y nuestras vidas no puede ser objeto de negociación en democracias consolidadas. Hablar de derechos sexuales y reproductivos es hablar de la capacidad de las mujeres para decidir, sobre todo, sobre nuestra propia vida, sobre nuestra autonomía, sobre cuándo, cómo y con quién decidir ser madre. Hablar de derechos sexuales y reproductivos también es hablar del acceso a una atención sanitaria y también de poder vivir libres de discriminación y sin violencias sexuales. Ningún político, ningún gobierno, ninguna institución podrá hablar nunca, jamás, de libertad con autoridad si no habla también de la libertad de las mujeres. En nombre del Gobierno de España, en nombre del Gobierno de España, permítanme que les hable de cuál ha sido nuestro camino defendiendo nuestros derechos sexuales y reproductivos, que lo haré de manera muy breve. En el 2010 tuvimos por primera vez una ley de plazos que permite abortar a las mujeres en las primeras 14 semanas sin ningún condicionante. Lo que las feministas defendimos en aquel momento fue que no se puede imponer la religión ni la moral de algunos sobre la legislación de todas. Y ese fue nuestro principal argumento. En 2015 el gobierno conservador presentó un anteproyecto que devolvía los derechos sexuales y reproductivos de las españolas a tiempos pretéritos, casi a tiempos de la dictadura. Y fueron las feministas quienes pararon ese anteproyecto en las calles. Sin embargo, sí que quiero decirles que se aprobó en 2015 hubo un retroceso en relación a las menores que en esos momentos se les podía poder abortar a las niñas, a las mujeres de 16 años sin consentimiento paterno. En 2022 actualizamos esa ley y dimos un paso adelante con una nueva ley del aborto. Volvimos a dar el derecho a las mujeres de 16, 17 y 18 años que pudieran abortar sin consentimiento paterno. Reforzamos la atención integral que necesita, si la necesitara una mujer que se va a enfrentar a esta intervención con refuerzo psicológico. Facilitamos información objetiva. Regulamos la objeción de conciencia y aquí es uno de los obstáculos que estamos enfrentando el Gobierno de España, la objeción de conciencia del personal sanitario y también por primera vez en España hubo y hay permisos laborales por bajas menstruales incapacitantes. También en España, desde hace unos años, el gobierno de Pedro Sánchez impulsó una reforma legislativa para introducir en el Código Penal el acoso a las mujeres que se producen en las puertas de las clínicas que van a interrumpir su embarazo. Acosar a las mujeres que van a abortar en España es delito y acosar a las profesionales que atienden a estas mujeres también es delito. Sin embargo, como les decía al principio, la reacción ultraconservadora es fuerte y además, tengo que decirlo, está muy bien financiada. Nos hemos encontrado en España cómo las organizaciones ultraconservadoras, por ejemplo, han alquilado edificios para poder poner ahí su publicidad contrarias al derecho al aborto. Y para esto, por ejemplo, todavía estamos buscando una solución para proteger a esas mujeres. Y creo que una de las cuestiones también importantes que debemos de hablar es de educación sexual y de la ley de educación, de la nueva ley de educación que tenemos desde el año 2020, en la que la educación sexual es obligatoria. Y cuando les explico cuáles son las dificultades que encontramos las españolas cuando en España para desarrollar esta ley, bueno, la educación en España compete también a las comunidades autónomas y depende mucho del color político y del interés en la defensa de los derechos de las mujeres de las comunidades autónomas de cómo se desarrolla esta norma. Tienen entre ustedes a Miren Elgarreta, que dirige uno de los organismos regionales, para que se entienda, autónomos en materia de igualdad, Emakunde, líder desde hace muchísimos años en materia de feminismo, que marcan, ¿no? Podemos ver cómo se marcan las diferencias entre las diferentes comunidades autónomas, el desarrollo y las diferencias de desarrollo de esa ley de educación. Esa es una de las dificultades que estamos enfrentando. Y también quiero decirles que si hablamos de educación sexual y somos honestas con nosotras mismas y con los problemas que tenemos, hay una generación de niños y niñas que la primera vez que ven algo relacionado o que creen, discúlpenme, creen que están viendo algo relacionado con la sexualidad es a través de la pornografía. Son grandes los retos que enfrentamos. El gobierno español en estos momentos está empezando a trabajar en cómo proteger a los menores y a los niños y a las niñas de la pornografía, que sabemos que muchos de ellos acceden por primera vez a estos contenidos de manera involuntaria y que la edad que lo están haciendo muchas veces es entre los 8 y los 12 años. Y por hablarles de algunas cuestiones que estamos dando pasos adelante, esta semana, por ejemplo, el Ministerio de Sanidad ha lanzado una campaña por primera vez para hablar a nivel estatal, para hablar de la menopausia. de una situación biológica que vivimos todas las mujeres y que estamos viviendo muchas mujeres en estos momentos, para cerrar tabúes y para hablar de nuestra salud, que también tiene que ver con todas las etapas de la vida de las mujeres. Permítanme que termine. Creo que ni la misoginia, ni la violencia de género, ni los reaccionarios entienden de fronteras. Entonces, creo sinceramente que la respuesta que demos desde las instituciones que apostamos por la igualdad de las mujeres y las niñas, con la colaboración siempre de la sociedad civil, tampoco tiene que entenderlas. Las feministas españolas cada 8 de marzo gritamos en las calles: solas no podemos, con amigas sí. Creo que es el momento de trabajar juntas para poder hacer fuerza frente a lo que nos estamos enfrentando, que no es menor. Muchísimas gracias.
Thank you so much, Ms. Hernandez. And just, I love one of your quotes, just women's rights are absolutely non-negotiable. So thank you. And thank you to all of our excellencies for setting the stage, each of you with all of your very powerful remarks. We're going to shift gears briefly to talk about barriers, but before I'm back here with my housekeeping rules, this is the passport that was lost. There we go. It is here. If this is yours, please let me know at some point soon. We're going to put it there. We're now going to move to our mini panel. We're going to shift our focus now to looking at systemic barriers that continue to hinder progress on SRHR. We'll explore the challenges ranging from legal restrictions to misinformation. So with that, I'd like to invite our two guests. We have Enid Mathoni Nadeja from the Center for Reproductive Rights, as well as our youth advocate and speaker, Zuhair from YPeer. Please welcome to the stage. Please sit wherever you'd like. We're going to move this. Okay, excellent. Can you hear me okay? Yes, mic check. Excellent. Okay, hello, my friend. Good to see you. Based on your, I think you can use the hand mic. Do you have a hand here? There you go. Great. Based on your experience, obviously you're the global chief program officer at CRR, one of my favorites, and curious from your perspective what you think are the most pressing legal barriers preventing women and girls from exercising their rights to bodily autonomy. And I think just at this point, we have obviously such a global pushback on SRHR, whether that's regressive laws or shrinking civic space. So how might you think about, from your perspective from CR, how you might counteract those trends?
Thank you, Kathleen, and thank you, UNFPA, for the opportunity to be on this panel to discuss these very important issues on how we advance gender equality by really focusing on sexual and reproductive health and rights on the sidelines of the CSW. And as you mentioned, at the center, we use the law to advance SRHR as fundamental rights. And we've been doing this for the last 3 decades across the world. And we use a combination of, litigation, we use legal and policy advocacy and research, and also, of course, our expertise on using constitutional, international, and comparative human rights law to transform how reproductive rights are understood by courts, governments, and human rights bodies. Now, talking about barriers, and from a CRR perspective, let me first talk about the discriminatory legal frameworks. In the past few decades, I think it's important to start by saying this, we've actually seen significant legal and policy environment advancement, enabling people to advance their SRHR. For instance, and I think you talked about this in the earlier on, Kathleen, about 60 countries have actually liberalized their laws and policies on abortion. Some of them have been as incremental as reforms moving from total bans to allowing abortion when the pregnancy is a threat to the woman's life, or when it's as a result of rape or forced marriage, or on some of the cases where it's based on other socioeconomic grounds. And others have removed medically unnecessary procedures. And of course, we know of countries, for example, Colombia and others in the world that have completely decriminalized abortion in some of the gestational stages. But of course, we have to learn a lot of lessons in these processes. We know that there are many legal frameworks that continue to discriminate against women and girls and limit their ability to make decisions. I think we've heard about that from almost every speaker that has been here today. For example, there's continued criminalization of abortion in many places. I think abortion is the one health service that you have to go and justify why you should get medication. To seeing adolescents being unable to access SRHR without parental consent, among other issues. And of course, when it comes to maternal health, and we've also alluded to this, we have shifted focus from just reducing maternal mortality rates and morbidity to also talk about person-centered care and and positive birth experiences. We want to see women and people who are pregnant supported to have safe and respectful maternity care. However, legal frameworks continue to discriminate against people, limiting their ability to make decisions about their own bodies. I think the minister from Sierra Leone said that sometimes you have to ask your husband whether he can go for services, right? We also know that there's laws that do not respect informed consent. Others prioritize fetal well-being over the well-being of pregnant people. And in other cases, we've seen laws that remain silent where they don't afford protection pregnant people during childbirth, resulting in confusion and ambiguity, especially on the healthcare staff. So they don't know that they can give services or they can't give services, or whether when they give those services, they actually end up being criminalized. We also know that legal frameworks don't operate in a vacuum, and there are a lot of systemic barriers and patriarchal norms that even where laws exist, then they are not implemented. A lot of times people talk about the natural role of women as mothers and caregivers, and other legal barriers and vacuums that impact minority populations and women who have got intersectional statuses that affect them. I'll also just talk a little about inadequate protection of the right to bodily autonomy. We've heard about that, I think, since we started talking here today. And I'd just like to share an example of one case that the center did in Kenya. We work in all the 5 regions, a case we did in Kenya in 2014 on behalf of a woman, a Kenyan woman from low-income background, who went to a government hospital to deliver, but was denied maternity care and was in fact abused during her labor and delivery. Because of the neglect of the staff, she actually ended up delivering on the floor. And when she was found unconscious by the nurses, she was beaten repeatedly and was verbally abused because she was accused of dirtying the floor and giving the nurses extra work. And she was actually then detained with her baby in the hospital because she could not afford she could not afford to pay the fees of the hospital. And this is a government hospital. Now, when we went to court, the government tried to argue, as we've heard before, that maternal health is a socioeconomic right that should be realized progressively, so that they didn't have to give this woman dignified care, neither did they have to actually give her services when she turned up. But we've seen courts that have been very progressive, and in this particular case, the Court of Appeal ruled that dignified and respectful maternal health care must be realized immediately because it is actually a minimum core right to health. Then I'll just touch a bit on accountability, because that is what we've heard about governments that are committing to be on the forefront, governments that have done things that have advanced maternal health and adolescents' rights. And what this case actually really highlights is that we must have rights-based accountability mechanisms that are really going to be very critical to root out the causes and the causes and the challenges that we are talking about. And that means that justice mechanisms, they have to be available and accessible without discrimination, including through legal representation. For example, the woman in Kenya would not have been able to afford a lawyer in private. And we also know that some of these mechanisms end up, as we had in the morning, actually criminalizing the women themselves for trying to access services. And then I'd also just like to mention, you talked about accountability mechanisms that should also be able to empower women to have the agency the agency to talk about their bodies, and the agencies to be able to make decisions. And this presumes that they can get information, quality information, in a manner and language they can actually be able to understand. And then on the pushback, because I think that is what all of us are living through right now, more than ever, I think I will not speak to the challenges because there are many, but I also just wanted to mention that I think one of the things that we've seen at the center is that during these unprecedented times, really working in cross movement and collaborating and having collective action is really the way to defend against erosion of human rights. I'm sure most of you have heard about, and I can see somebody with the green bandana, the Green Wave movement in Latin America. I think it's one of the things that we should all celebrate, and we should all celebrate. They've been able to achieve so much because of that, the strength of that movement, and really like to honor you. I don't know, but I really to honor you. When I see that bandana, I know you're one of us. So really. But that means that we also have to think about working with across issues. A lot of times our issues are used as wedge issues. We have to work with groups from young people. We have to work with the groups that are working on LGBTQI rights as well, and also groups that are working on democracy, because we have to underpin a lot of this progress on rule of law and institutions that are actually progressive. And then secondly, we've seen that we use, for example, at the center, getting positive precedents actually are very important. We've been able to see a lot of the rulings or judgments that we get at the UN that then enable us to go back and hold governments accountable in places where the legal frameworks at the national level are not very progressive. So the importance of really using some of these frameworks and holding governments accountable to declarations like the Beijing Platform for Action. No, it's not like a binding document, but it provides language that can help us push for international norms, and of course the ICPD agenda. And then just to mention that finally, I think we have to continue to monitor and counter activities of the anti-rights actors at the global, regional, and national levels. We've talked about the misinformation. I think a lot of time that is the biggest problem that we have to deal with, and we cannot do that unless we have a coordinated and aligned strategies that we learn from things that have worked in one region that we can take to another region, and of course to be able to work with other civil society organizations, including, I'd like to mention here, being very mindful of the plight of women's human rights defenders, who are the people on the ground that a lot of times get targeted when they try to advocate for rights of women and girls and other people. Thank you very much.
Thank you so much. I was scribbling lots of notes here, so there will be a quiz. But you did touch upon a number of the barriers. I mean, you said on a legal framework side, I had obviously criminalization of abortion, a lack of informed consent, a lack of protection during childbirth. But I pulled two positives, as you say. The first is obviously the need for collective action as a potential solution, but also looking at those positive precedents and making sure that we're bringing in and enforcing accountability on the UN framework. So thank you. At least we have two solutions. So we're starting early on the solutions side. I'm going to come over to Zahir here. Do you have a mic? There you go. Thank you so much. Very similar question. In terms of what is your perspective in terms of what you think are the most pressing structural barriers that young people face in accessing SRHR services? And as a follow-up, just from your perspective, how do you see these inequalities playing out in terms of young people's access to SRHR?
Thank you so much. Thank you so much for the invitation and for this opportunity to be part of this event. And I'm sorry, I will speak in French. C'est un immense honneur de prendre la parole. Donc aujourd'hui, sur ce sujet essentiel qui est en relation avec les barrières d'accès des jeunes dans toute leur diversité aux informations liées à la santé sexuelle et reproductive. Donc, parce que de-delà des chiffres et des politiques publiques, donc il s'agit des histoires réelles, des vies impactées des jeunes et d'un avenir qui se joue dès aujourd'hui en relation avec l'accès à la santé sexuelle et reproductive. Donc, nous savons que les jeunes, dans toute leur diversité, donc y compris les jeunes en situation de handicap, les jeunes les jeunes LGBTQ+, donc font face donc à plusieurs obstacles pour accéder donc aux informations fiables et à à des services dans la santé sexuelle et reproductive. Donc, par exemple, au Maroc, comme de nombreux pays, on partage la même situation avec plusieurs pays africains, donc et arabes. Donc, la sexualité ou bien l'éducation sexuelle complète reste un sujet tabou. Donc, on en parle peu dans les familles et pas assez dans les écoles et souvent avec beaucoup de désinformation et des fausses informations dans ce sens. Donc, cela résulte en ce que les jeunes se retrouvent livrés par eux-mêmes, exposés au risque de grossesse non désirée, des comportements sexuels à risque et non protégés, des infections sexuellement transmissibles et d'autres pratiques sexuelles déviantes et même de violences sexuelles. Donc, les inégalités d'accès aux services de santé en général et de santé sexuelle et reproductive en particulier, compliquent encore la situation dans ces pays-là. Donc, par exemple, le Maroc, le ministère de la Santé et de la Protection sociale a mené une enquête en 2016. Donc, cette enquête souligne que seulement 25,6 des jeunes avaient reçu des informations suffisantes sur leur sexualité et leur santé sexuelle et reproductive. Donc, cette situation est pire encore pour ceux qui vivent en milieu rural ou bien dans les milieux défavorisés, dans l'accès aux soins et services de la santé sexuelle et reproductive reste très limité ou bien inexistant. Donc, il y a aussi la question de la discrimination du genre et d'autres formes de discrimination dont les filles rurales sont plus touchées par des normes sociales, des normes juridiques et des normes religieuses. Il y a aussi des restrictions liées à l'éducation sexuelle et l'accès aux soins, dont les jeunes, dans toute leur diversité, font face à des barrières supplémentaires, notamment la stigmatisation et l'absence des services adaptés à leurs besoins. Donc, ce que nous devons comprendre dans notre situation, c'est que les jeunes ne sont pas des spectateurs, mais des acteurs du changement social dans leur société. C'est partout dans le monde, y compris le Maroc et les pays africains. Donc, les jeunes s'organisent, sensibilisent, demandent des réformes, ils lancent des campagnes de plaidoyer, de réformes des lois, en matière de tout ce qui est en relation avec la santé et la santé sexuelle et reproductive. Mais trop souvent, leur voix n'est pas prise en compte dans la prise de décision et leur intégration dans l'implémentation ou bien la mise en place des politiques publiques dans ce sens. Donc, il ne se fait pas, à mon avis, de donner la parole aux jeunes lors des conférences, mais nous devons les intégrer dans les politiques publiques dès la mise en place et de leur donner les moyens d'agir et leur offrir aussi un accès réel aux services et aux informations liées à la santé sexuelle et reproductive. Donc, dans ce sens, si nous voulons vraiment créer un changement social et d'intégrer la jeunesse dans cette dynamique-là, nous devons agir sur plusieurs aspects. Donc, la première des choses, c'est d'introduire une éducation sexuelle complète à l'école, adaptée aux réalités culturelles et religieuses, mais aussi basée sur des faits et non sur des tabous. Donc, parce que suite au référentiel de l'UNFPA et de l'OMS, l'éducation sexuelle peut jouer un rôle clé pour prévenir donc les comportements à risque et promouvoir l'égalité des genres et des sexes. Aussi, de travailler donc en collaboration avec les parties prenantes pour supprimer donc les obstacles légaux qui empêchent donc les jeunes d'accéder aux soins sous le consentement parental. Par exemple, je donne l'exemple Maroc, qu'il y a des jeunes ou bien des adolescents moins de 18 ans qui n'ont pas donc l'accès donc aux contraceptions, aux méthodes contraceptives, parce que ça nécessite donc un consentement parental. Et aussi de garantir donc des services liés à la santé sexuelle et reproductive. Ces services doivent être des services gratuits et accessibles à toutes et tous. On doit travailler également sur la formation donc des professionnels de la santé dans ces pays-là pour qu'ils accueillent donc les jeunes dans toute leur diversité sans jugement et en respectant également leur confidentialité et leurs besoins spécifiques. Donc finalement, je souligne que l'accès donc des jeunes dans toute leur diversité donc à la santé sexuelle et reproductive n'est pas donc un luxe n'est pas un luxe, mais une question secondaire. Donc, la santé sexuelle et reproductive est un droit fondamental qui a un impact direct sur la santé, l'éducation, l'autonomie et l'avenir de toute une génération. Donc, parce que une jeune ou bien un jeune formé et autonome est un adulte ou bien une adulte libre et en bonne santé. Merci.
Thank you, Zahir. So many challenges that you've mentioned are just a few. I mean, you talked quite a bit about financial barriers, the additional barriers of those with LGBTQI plus identities, the lack of accurate age responsive CSE, and a lack of access to affordable contraception amongst many other barriers. I really thank you so much for your perspective. So this was the first part of many, many panels. Let's give it a round of applause to our two speakers as we address a number of barriers. We are going to get to solutions, but we're going to have a little intermediate conversation. We see that we have our representative. No, not yet. Okay, we will be moving on. Forget about that break that you had. We're moving on. Before we've talked about barriers, now of course we need to be talking about driving solutions to catalyze change. And so we'll be bringing up two speakers to talk a little bit about the way forward, or the push forward, as we've been hearing today. We'd love to bring to the stage Professor Sarah Hawk of Global Health 50/50 to join me, as well as our friend Nalini Singh, the Executive Director of the Fiji Women's Rights Movement. So please, if you could join us on stage. Thank you. That was not a very good round of applause. Let's try that again. Round of applause. Excellent. Perfect. So again, in our earlier discussions, we talked quite a bit about the barriers. And again, what we really want to do is focus from both of your perspectives of what are the policy interventions, what are some of the practical solutions that we can turn to strengthen SRHR globally. So Sarah, maybe I'll start with you. Oh, you have a mic, great. So you have 30 plus years of experience doing this work, so no pressure. But from your standpoint, what are the key components of an integrated SRHR approach that sort of improves health outcomes for populations? And I'm just checking the time. I'm going to ask you the second question at the same time for time, but just in terms of, what are some of the proven strategies, again, to dismantle gender barriers in the health workforce and just be able to strengthen health systems at large?
Thank you.
Small question.
Yeah, thank you very much. And thank you very much to UNFPA for the opportunity to speak with you today and hopefully engage in a dialogue with you today. And I think that over the past hour and a half, we've heard quite a lot about the importance of, for example, the legal environment and the policy environment as being fundamental to achieving SRHR goals. And I would say, actually, for me and for the work that I've done over those 30 plus years, that it's become increasingly clear to me as somebody who started off at the practice level and somebody who then moved into the arena of gathering and collating evidence, that actually what really matters if you want to see change is you have to have the underlying legal and or the legal environment in place in order to avoid us being in a situation where what we're all relying on is some kind of discretionary decision making, that we're actually all able to claim our rights to SRHR services, for example, or our rights to gender equality in the workforce that I will come back to in a moment. And so I would say, sort of, you know, looking back at that long sweep of 30 years of history, that it feels like we're in a really, really damaging, difficult, distressing moment. And of course we absolutely are. But if we look at the kind of long arc of history of pushing forward on SRHR, pushing forward on gender equality, it's not kind of a single line trajectory towards equality. It's always an up and down sort of sine wave and right now we're in a big dip, but it will get better is all I can say from that kind of historical perspective. And it gets better partly because, as we've heard from many speakers today, there are legal changes that take place. There are legal rights that become embedded in situations where none of us had perhaps expected it to happen. But so for that, I would say that the legal changes don't just happen by themselves. They happen generally because there is a supportive political environment. You have to have a set of politicians or lawmakers who are concerned about inequalities, who think that inequality matters, and who are committed to universality. And unless we have those people in place, very difficult to push for legal change. But where we've seen legal change happen over the years is not just because people at the top sitting in positions of decision-making power decide that we should make the world better, but because of social movements from the ground up. And if we think about, coming back to how do we achieve gender equality in the workforce, it's not just about people sitting in law chambers or people sitting in parliament. It's about the role that, for example, trade unions have played over the past 120 years in actually pushing for workers' rights. So I would say that in order to achieve that legal and policy change, it's kind of pincer move of top down, bottom up. I would say, as somebody who has spent 30 years looking at evidence, that evidence does matter, despite everything that we're told, that we live in an age of disinformation and misinformation, which of course we do. Data and evidence really still matter, and it's why billions of dollars are invested in harvesting our data. So anybody who tells you that we don't have enough data is thinking in a really narrow way about what data is actually out there and how data is being used. So ideologically, I'm not one who really promotes the idea of public-private partnerships, because I think from a health perspective, it's really difficult to look at the role of the private sector and say, and here's how they contributed to population health over the past 30 years. But I think that given that most of the data that most of us are concerned about is sitting in the private sector, in our pockets, going to the private sector, that we need to actually start to think about how we better communicate and work with the private sector to access the data that we actually need. And it's not just data to tell you how bad the world is, it's data to hold the power holders to account. That's why we set up Global Health 50/50, to use data for accountability. So I'll stop there. That I hope that that's a way of saying that change can happen.
Great. Thank you so much, Sarah. And just a few things I picked up. I mean, one, as you just said, some of the solutions is this kind of connects the two: legal rights being embedded, obviously a very supportive political environment, obviously bottom up in terms of social movements. I think a good call on terms of the role of trade unions have had, you said, over 120 years. And my favorite perhaps is that evidence and data still matter. That's an important this week, and just the role the private sector has to play in that partnership. So thank you. So you get an A. There's a few solutions there. Thank you, Sarah. And Nalini, over to you. A very similar question from your perspective. How does an intersectional approach strengthen SRHR advocacy? And just in terms of a follow-up question, kind of what, from your perspective, what challenges arise in addressing SRHR from an intersectional lens? And obviously calling out specifically some of the examples from the Pacific. Oh, here, you might need the mic.
Thank you so much, Kathleen. Bulavinaka, everybody from the Pacific. I can feel the energy really being low, so I feel as if I should go into workshop mode and get everybody to do an energizer to lift up this energy. So if you feel like a stretch, I don't mind. Go ahead, because I understand jet lag. I feel that way too. Thank you so much for having me here. I'm always appreciative of the space that UNFPA creates to talk about how to turn things around, especially since we've had 30 years of ICPD as well. I'm a very strong proponent of continuing the agenda that ICPD set for all of us. A little bit in terms of the reality around from where I am. I come from the Blue Pacific continent. It has over 20 small island states and territories, all very diverse languages and cultures and peoples. But the SRHR issues are the same across the over 20 states that we have. So speaking about, and one of the reasons why solutions have not worked is because an intersectional approach has not been taken. A great many times legislatively and on policy, we have great papers, I'll say that, great paperwork, because there's a lot of collaboration between the global north, global south in terms of getting the paperwork done. But when that needs to be translated into action to fulfill what women and people need, then there's so many issues because of the diversity within the Blue Ocean and within our own countries. So responding to the different needs. So intersectionality is very important, and how that strengthens SRHR advocacy is it makes us look at barriers in a holistic way. We understand the barriers because examining how different identities intersect, advocates like us, we can talk about the unique barriers that individuals feel and face when they are accessing services for sexual and reproductive health. For example, the LGBTIQ plus individuals, or rural women or indigenous women, who may lack the cultural sort of sensitivities around, how in terms of asking for what they need. So by having a holistic understanding of the barriers by those that are providers and those that are policymakers, that is one way. Second would be, that would lead to more inclusive policy and program design, of course, because understanding the differences would ensure that we don't apply the one size fit all approach that is so easy to do, and which is often done. There's so many examples, and there's a couple that I can give, a couple of examples from my own country, was when we had data around school girls missing, school, And it was due to not having wash facilities or the appropriate pads and all of that. Our government decided, Minister of Education decided, oh, they will give out free pads to girls. Now that's great, but did the pads reach those that needed it the most in the rural and maritime areas? Or did it just go into the urban, peri-urban areas where access was not an issue? So that's one. And then now my government is talking about implementing menstruation leave. That is great, and we are strong advocates for that. But what happens to those that fall out of the formal employment sector? What happens to those that are in unpaid care work and in the informal sector? So, what kind of protection is there? So it does work, but that's where that intersectionality lens needs to be applied. Third would be, bringing in marginalized voices into the conversation, the ones that are being left out, and the experiences of those that are overlooked and perhaps who need the services the most. So again, we're talking about the rural indigenous women, persons with disabilities, LGBTIQ plus persons, or even young people, who have a lot to say in terms of shaping the SRHR policies. And finally, I think strengthening the way in which we advocates and activists work, the kinds of alliances and coalitions we build, in recognizing that there are multiple layers of discrimination fostering across, the different sectors, and it requires collaboration. It requires uniting feminists, disability rights, LGBTIQ plus, and indigenous women's, rural women's, all the movements for more powerful advocacy in this area. So when we do that, of course, there are a number of challenges, as you've asked, that comes up. So the first one, I think we've talked about and touched on a little bit, and this is around deeply rooted cultural and religious norms, and intersecting with patriarchy, of course. So in many Pacific Island societies, we have very strong religious and cultural beliefs that restricts open conversations on anything SRHR, from going to talking about gender identity, contraception, abortion, to having nothing to do with comprehensive sexuality education, and so forth. And that is quite a contradiction for us, because it's become even stronger, sort of post-independence, with us, many of the states in the Pacific, being colonized or still, being a colony. And what we see now is, if in our efforts to decolonize, it's quite a challenge, because many are still following or are deeply, following the colonizers' religion, which is the restricting factor here, because prior to this, our cultures were quite free, in terms of, sex and sexuality, and I'm assuming health as well. Second would be the geographical barriers and limited resources. We are so dispersed geographically, and even though the issues are the same, but that does limit the kinds of services we have. And an example I can share is, last year we were at the 15th triennial held at the Marshall Islands, and the country's representatives were talking about HPV vaccines, and one country said, we really have a problem with that, the shortage of vaccines for our girls. And then the neighboring country said, oh, you should talk to us. We can share some because we have surplus. And I was so amazed by that it just took one conversation, and the two women's ministers, had some sort of a deal, which I hope resulted in change. But that's the kind of problems we have. Very evident when we had COVID as well, where almost all the services around SRHR were either limited or restricted or even stopped. The third was the legal and policy gaps that we've heard a lot about. We have outdated laws, even though we are, many of our states are independent states, but outdated laws that criminalize same-sex relationships, restricted access to abortion, and fail to recognize the rights of persons with disabilities in healthcare even. Well, that is shifting now, with many states having signed on to the Convention on the Rights of People Living with Disabilities, but the gap is still remains because progress is slow. The second last is around data gaps. You know, you're right, Dr. Sarah, Professor Sarah. There is a lot of data, but in the intersectional approach, the different ministries need to talk to each other to come to a holistic understanding and designing programs that address the needs of a person. But no, that doesn't happen. And I don't know where it's happening well, because we need to learn from that. And finally, stigma and discrimination. Marginalized communities such as the LGBT plus communities, sex workers, and even young people seeking contraception, drug users as well, you know, they face a lot of discrimination from providers. And so one of the things that my organization has been doing is trying to get you know, workers in healthcare, from the security guards to nurses to doctors to administrators, to be JET-C sensitized, because that is needed aside from, you know, law enforcement and society at large.
A to Nalini as well. I have so many solutions here, but I've picked out just 5. So sorry, just 5 out of the group, but I just obviously centering an intersectional approach, making sure that we have a holistic understanding of the barriers, inclusive policy design, empowering, of course, marginalized voices, and really strengthening, of course, our alliances and coalitions. We've been sitting a lot. We have 15 minutes left, which is not very much time, but as there's 200 advocates in the room and no one has gotten to ask any questions yet. So we're going to try, I think, maybe we'll invite the Center for Reproductive Rights. I don't know if Zahir has left, but if you want to join in the stage, I'd love to see if there's a couple questions in the room before we wrap up and close. So any hands? Oh, okay. We have 1, 2 back there. Okay, let's see. Mike, maybe we go there first. And if you could just, if you have a particular speaker in mind, feel free to address that. We have Mike. We'll share that.
Hi, do you hear me? Yeah. My name is Daniela. I'm from Mexico. And I would like to ask, do you believe that the UNFPA or your countries, it's fine, should work on creating a future where women no longer have the need to have an abortion by addressing the underlying issues that lead women to make this difficult decision? Thank you.
Maybe if the center wants to start with that one. Okay.
Thank you very much. Yeah, you know, I think that's a good question, and I think there are things that could be done to make sure that women don't need an abortion. But you know, abortion is a health right; it's a healthcare need, and it's not every person who goes for an abortion because they want to have an abortion, right? Sometimes you need it for life-saving services. Sometimes it's because the person maybe just wasn't ready for the pregnancy, or maybe somebody was raped, right? So yes, we could do a lot to stop gender-based violence. We could do a lot to address underlying health conditions that could make people need to have an abortion. But I think for us at the center, really, what we say is that actually abortion is a health service, right? Like I can't imagine a point at which you'll do everything to stop having headaches, right? We can drink water, you know, but at some point you'll get a headache because it is a health need. So I get what you're talking about. I think all of us have a lot of things to do to address, you know, maybe contraceptive needs. Maybe we have unmet needs for contraception for those ones who want a contraception. We could do a lot to address the violence that makes people maybe get raped sometimes. But I think all of us must approach this from a point of agency, that if a woman wants an abortion for whatever reason, they should be able to get it. Thank you.
We have 1 mic back there. Excellent.
Hi, everybody. My name is Lucy Atkin. I'm another one of those white-haired ladies here at the at the forum that has worked in this field for over 35 years. But right now I'm working with an organization called the Inclusivity Project, and we focus on the most marginalized of many cultures. And I was very pleased to hear one of our speakers talking about, I mean, there are a lot of different kinds of women, but we really can't forget some of the most marginalized. And some of them belong to what the UN is calling the communities discriminated on work and descent, CDWD. It's a lousy acronym, but it refers to all the communities that probably used to be called untouchables around the world. So we're talking about the Dalits in South Asia, the Roma in Europe, and the Quilombola and the Palenque in Latin America, as well as the Haratin and other groups that are related to caste type discrimination in Africa. And they don't get much mention throughout the CSW. We're talking about 20 million or more people around the world. And these are the women who are raped, beaten, in silence, and many cultures and governments don't want to talk about it. And I just want to raise the issue that women's gender-based violence is very rampant in these communities. We are having a session on the 19th at 4:30 of centering women and girls in the global movement of communities discriminated on work and descent. So I invite you all to join us then.
Great, thank you so much. Sarah, do you want any reflections to that?
Yeah, thank you. From a peer, clearly an age peer. So I guess what I want to reflect on is really coming back to the point I made about the data in our pocket. That we are living in an age of, as Susanna Schroff called it, surveillance capitalism, where clearly, big tech, big data harvesters out there know absolutely everything about us, often before we even know it ourselves. And that's how they, understand and manipulate and exploit everything about our individual agency or risk or belief systems, etc. What strikes me after 30 years in the business of health and development is how unbelievably poor surveillance systems are that actually are able to capture the kinds of inequalities and inequities you're talking about. And I'll give you one example that during COVID, as Global Health 50/50, we looked for the data. We predicted, not through some sort of crystal ball, but through just looking at the literature, we predicted as COVID started off, and you'll know that it's 5 years ago yesterday that it was declared a global health emergency. But in February 2020, we looked at it coming and knew that there were going to be sex differences in the course of the disease. And so we started looking at the global agencies who are responsible for reporting on health surveillance to see what the data was actually showing. And we couldn't find the data there. We could not find sex disaggregated data on the WHO website, on any of the websites of the agencies that get quite a lot of cash to do this kind of reporting. And so we started doing it ourselves. And for the next 2.5 years, we collected data from every Ministry of Health in the world every week along a pathway from vaccination through to mortality, where we could find sex disaggregated data. And what I can tell you, and this is after decades of billions of dollars being poured into HIV surveillance systems, for example. But still, after 2.5 years of collecting this data, we only found 18 countries that sex disaggregated their vaccination data. We didn't find a single country that
that disaggregated COVID data at any point for refugees, not one. So it strikes me that we know that there are inequities. Every country has inequities of a different kind out there, but as public sector people responsible for identifying inequities, we are unbelievably bad at it. And it's a shock to me that we know that data matters. As I say, if it didn't matter, they wouldn't be putting billions of dollars into harvesting more of it. But as the public sector, we haven't invested enough in any kind of disaggregated data, despite commitments being in place since 1976 to do so. We're still not doing it.
So much, Sarah. So I think we are almost out of time, it sounds like. So I'm going to pause on questions and try to do a wrap up before bringing it to UNFPA to close. I know this is a lot of time. 2 hours as advocates in a seat is a very long time. So let me try to just summarize. Again, I think we started with Dr. Natalia. I hope over the last 2 hours, we started with, there's a number of challenges, but what are the solutions? And I hope at the end of the 2 hours, we've emerged with hopefully some hope and positivity, right? We have made a number of wins and we need to hold the line. Over the last 30 years, we have seen wins in terms of rights, in terms of SRHR, and we've heard today, again, that it is because of the strengthening legal framework. It is because of coalitions. It is because of grassroots activists, youth organizations, and so I hope we can take these solutions with us as we go and carry on through CSW. So to wrap us up as we started today, we want to thank our host, UNFPA. We have Dr. Will Zeck, who's the Chief of Program Branch Liaison for UNFPA, to close us out. But I just want to say, as I finish my moderating role, thank you all for the last 2 hours, for your hope and inspiration. Thank you.
Thank you very much. When I was standing in the lobby today, I was seeing all these crowds of people coming in, you coming in. And I think it's just great that you're here, that you have made your effort, that you stayed so long also. 2 hours is long, but it's important that we're here. So really happy to see all of you. I would like to thank you for coming, but also our co-hosts, the government of Moldova, Panama, Sierra Leone, France, and Spain. Gender equality is a shared responsibility. It's a human right. It's based on human rights, and this is when we need to go. And linked to that is universal access to SRHR, but also maternal health and reducing maternal mortality. I worked 10 years as a gynecologist. I've also witnessed a lot of the violence that you've been talking about. It's also important, if we see violence, we have to act in a daily life. So it's not about advocacy, but also us living. That's very important. There was a lot of positive, but also some negativity. I would like to close with some positive going forward. We could create a dance, maybe the up and down dance and the push forward dance or something like that, probably. But from UNFPA, I just wanted to say we have three strategies, and one outstanding one that has recently been launched. It's a strategy for reproductive maternal newborn health and well-being. Have a look at that. It's called Start With Her. It brings a lot of hope, and it also shows the great acceleration we have in maternal mortality. It's also linked to a gender strategy we have developed and the youth strategy. Have a look at that, and let us also celebrate a lot. You know, we have achieved a lot, and pushing forward, we can achieve so much as long as we stick together. And I can see this in the room, and having so many of you here, think of human rights and keep on pushing forward. Thank you.
I think with that, it concludes. Thank you so much. We wish you the best at CSW. And I guess we still have someone's passport. I'm going to go somewhere with this, so please see me at the end. Thank you again for coming. We'll see you later.
Thank you. You did a great job. In multiple languages, very impressive. Very, very impressive.
Yeah.